it has been only in the past 10 to a little more years that we are able to support people that want to be pregnant during CML. You need to distinguish between male patients and female patients because, of course, male patients can have problems with the fertility, but usually once there's the conception, is uncommon that you have problem due to the drug exposure. While with the female, the problem is that you carry the baby. In the first part of the pregnancy, you expose the baby if you're taking drugs to the drugs that can interfere with organogenesis. And also in the second part of the pregnancy, the drug can pass through the placenta and have problems and interfere with the pregnancy and the baby. And besides, you don't have to forget that those patients are affected by CML, and thus stopping or continuing the drug is an important challenge and must be evaluated case by case. As the use of Asciminib is going to increase, because also in Europe now, other than in the US, it has been approved for the first line, we need to know more about it. So we decided to harvest data as we harvested with the other TKI inhibitors on Asciminib, and we asked the help of the company that could give us the access to the reported clinical trial and also other side effects registries that they have access to. And other source of the data were spontaneous report after spreading the word that we were harvesting those cases. And so far we have harvested 47 cases of pregnancy during Asciminib, 13 male conception and 33 for 34 pregnancies, because one was a twin, female conception. With the male conception and pregnancy, we didn't evidence any particular problem. 8 patients were exposed to only Asciminib, while 5 patients were exposed to Asciminib in combination with dasatinib, nilotinib, or imatinib. In the female part, most of the patients had stopped the drug before the 5th week of gestation, while one patient, maybe 2 patients, were exposed until the 6th or the 9th week of pregnancy, and one patient was exposed during the 2nd and 3rd trimester because she had to resume therapy, not having responded to interferon. For the female point of view, we didn't recall particular problem, while 2 patients were reported to have some congenital abnormality, and those are actually now object of a major focus. For one that presented with a cardiac malformation, unfortunately the follow-up was lost. She was exposed for 5 to 6 weeks. While the other patient was exposed until 8 weeks, but the malformation that was not reported was not deemed related to the Asciminib, since the patient was taking other drugs that were more eager to produce malformations. So for Asciminib also we still recommend contraception, and to report any case of accidental exposure. As soon as the woman is pregnant, you should stop the drug, because even if the mechanism of action is not like TKIs, since the TKI proteins are more, the ATPase protein are more common, while the myristoyl pockets are less common, still we don't know that much about this drug, so we must be careful, but encouraging results are on the way.